Plantar fasciitis is typically a pain that occurs in the bottom of the foot. It's located usually close to the heel bone, and patients most often complain that it hurts first thing in the morning when they put weight on their foot. Typically, the pain will slowly reduce once the patient moves around and begins walking, within about 5 to 10 minutes usually, but will return later in the day, especially if the patient's been sitting for a long period and then gets up to stand again. The pain felt can quite often be fairly debilitating because one is bearing weight on a painful structure in the bottom of the foot. And so this affects up to 10% of the population. Now, while most people have heard about plantar fasciitis, what they may not have heard about is something called plantar fasciosis. And it's a technical term, but the difference really is the difference between inflammation in the structure that's causing the pain versus degeneration, which is occurring in the structure. And with plantar fasciosis, what we see under a microscope is small degenerative tears in the fascia of the plantar structures. And so to orientate you on the foot, if this is the foot, and if I particularly turn the foot underneath, what we're talking about is the plantar fascia, which attaches on the heel bone and runs up to the toes in a fan-like structure. And so where things usually break down is at the point of attachment on the heel bone, and we're either talking about an inflammation or a degenerative process right at this point. One can develop pain in a structure that gets repetitively overused. In a normal situation, the plantar fascia is designed to be able to take the load put on it every day. But when things are not aligned optimally, or when we have muscle imbalances or joint imbalances, the plantar fascia can become twisted in a sense, which is an abnormal strain placed on that structure multiple times during the day. Every single time you step on your foot, you basically irritate that structure and it becomes inflamed and swollen, or becomes degenerative, which can also cause pain and dysfunction. The way that it's treated is really in multiple ways. A physiotherapist would need to do an objective assessment to determine which structures might be predisposing the individual to getting this pain, such as a malalignment in the hip or the lumbar spine, or an irritated nerve, possibly from a disc in the lower back. But typically the physiotherapist will use soft tissue techniques such as massage or stretching, joint mobilization techniques, or even some advanced techniques such as acupuncture or intramuscular stimulation. Intramuscular stimulation is especially useful if it is determined that this is a degenerative problem, in which case a nerve root is functioning abnormally, and IMS or intramuscular stimulation is a great way to solve this problem. Something else that is commonly used is orthotics, and while orthotics can be useful for certain individuals, they're not necessarily going to help everybody. It's important to ascertain whether your foot needs an orthotic, and if it does, how long would that orthotic be useful for? Because once you have an orthotic, it doesn't always follow that you'll wear an orthotic forever. So it's really important to have good advice from a physiotherapist trained in these biomechanical issues to determine whether IMS or acupuncture would help you, or whether your problem is going to be solved more readily by joint mobilization or the prescription of rehabilitative exercises and possibly an orthotic.